to Searching for Healing. Searching for Healing is all about finding ways to heal naturally without drugs that have side effects. I'm here with Dr. Haskell today. Dr. Haskell has his own naturopath clinic.
Mm-hmm. Holistic Alternative Medical Clinic, yes.
Thank you. Dr. Haskell, what is your degree to practice medicine?
Mm-hmm. So in the state of Utah, we have the law that a physician, a medical doctor, of course, has a license, but also naturopathic physicians and naturopathic doctors have a license to practice medicine. So the background that I have as a pre-med from San Francisco State University and then on to what's called the National College of Natural Medicine in Portland, Oregon. It was a 4-year program which I graduated from 30 years ago. So my license here allows me to basically practice as a physician, ordering lab tests if required, prescribing medications if necessary. And it's a very nice sort of a mandate for alternative medicine for those who are interested in seeking alternatives to the medical sort of way of going about things, which is primarily pharmaceutical.
So the thing that Dr. Haskell does is he finds not just the symptoms. He doesn't treat the symptoms, you treat the problem, right? That's the whole goal of...
Yeah, it sort of in a nutshell is that, you know, people present with different symptoms, whether it's a obvious physical symptom or more malaise or chronic fatigue or sometimes depression. So, of course, every sort of diagnosed condition, there could be a pharmaceutical medication that would be prescribed for that symptom or condition. But ideally, what I believe medicine in its altruistic sense should be looking at the diagnosis, but then what are the underlying issues that are causing that symptomatology? Because
do you find a lot of times, like, somebody has a symptom, they go to a medical doctor, they get a prescription, and then they have side effects from that symptom? So then they have to go and get another prescription to combat the side effects of the first one?
That does happen.
Kind
but
of
I
a
think
cycle?
Probably more common would be that people with a symptom, let's say I feel tired, I feel depressed, the doctor will run a series of lab tests that are fairly what are run by doctors for most people. And the lab tests come back and the doctor says, well, everything is normal, everything is fine. And then they'll sometimes recommend a psychopharmaceutical for the depression. But the types of tests that are done by a lot of medical doctors are not as comprehensive or
generic,
as deep as they should go to really understand more about the underlying biochemical issues. And that's where a lot of frustration happens with people, is that they know they're not feeling well. Mm-hmm. Their doctor is saying that all the lab tests are normal, any kind of CAT scan or ultrasound, these are all showing normal. So is it in your head? Mm-hmm. Is it your issue with your symptoms in your head? Is it due to stress, mm-hmm. lifestyle stresses which are causing it? Mm-hmm. And people are frustrated because they know they don't feel well. So that's the kind of person that often comes to me. So we do more comprehensive testings. We talk about the psychology. We talk about the effects of the mind, our thoughts and our feelings, how those affect our biochemistry.
Tell me, Doctor.
But you are right about the side effects, for sure. The side effects, and this is part of the essence of alternative medicine or holistic medicine. We use those terms these days to differentiate us from sort of the orthodox medical system, but holistic medicine has been practiced for centuries. Hippocrates, you could say he was an alternative holistic practitioner. Mm-hmm. He said there's 2 primary causes for people to become ill. The first is, and this is 2,000 years ago, the first is that the body is not, or the cells of the body are not receiving the nutrients they require for optimal function, basically nutritional deficiencies. So especially today, mm-hmm. we have millions of people who are not eating nutrient-dense foods. So everyone these days has nutrient deficiencies. So that's one underlying cause. Mm-hmm. Other, which Hippocrates spoke about, was our exposure to environmental toxins. And these days, our household, our environment at work,
everywhere.
Are everywhere.
Our frying pans.
Everything.
Pesticide
Cosmetics,
on the lawn.
Lipsticks, cream, everything. So it's an issue for everybody that I see, there's got to be some degree of investigation of that underlying cause.
Would you call that
autoimmune?
Are those autoimmune problems?
Well, autoimmune issues primarily occur when cells become inflamed in the body. Cells normally have a certain lifespan, but inflammation causes those cells to die off more rapidly. When the cell dies off, the body will form antibodies to those cells or to the contents of those cells. So antibodies are usually formed primarily from premature aging of the body due to inflammation. Inflammation may be caused by various things, including pathogens or bacteria. It can also be caused by nutrient deficiencies. A lot of different things can cause inflammation in the body.
Would you say that it all starts with us not getting the nutrients that we need, kind of? That's what the basic of where it all starts?
I think so.
Stress?
Yeah. Stress is certainly causes the body to causes the body to need to act more optimally or more healthy and stress tends to deplete those nutrients in our body. So I think you're right, nutrient deficiencies is a primary underlying issue with aging in general and susceptibility to illness, susceptibility to the genetics beginning to shift in the body and bring out predisposing factors genetically. So I think you're right.
Let's talk about sugar now. Would
Sugar.
you consider sugar to be the legal cocaine?
Oh.
Is that too extreme?
Well, I think that it certainly is a major component of developing chronic disease for many, many different reasons. I mean, that would be a program or a show all into itself.
It would be.
It would be, and I think that.
Does it cause a lot of illness, as you would say?
Well, if you think about what happens to how the body has to react to sugar coming into it, is that when we take in sugars, those are absorbed into the bloodstream. Blood sugar goes up, and the body has to react to that. So it produces a hormone called insulin to get the sugar in the blood to start coming down. That insulin is shunted into cells of the body. But the thing is that most people don't understand, I don't think a lot of medical doctors understand, is that there is no such thing as just sucrose, so let's call it glucose, from whether it's from sugar cane or whether it's from beets or whatever it may be. Glucose is attached to fructose. It's bonded to fructose and glucose together. When that bond is broken through the digestive system, glucose is absorbed, glucose goes up, and the body uses that for energy. Okay? The fructose is absorbed, it goes to the liver and forms what are called triglycerides, which is a form of, let's say, potential energy or fat. That triglyceride is shunted into fat cells. Now the body starts having obesity problems, primarily from the fructose part of that sugar molecule, that sucrose molecule.
Okay.
But the issue is that a lot of these environmental toxins and residues the toxins we're absorbing and the residues left over, the body can't completely excrete from the system because of lowered vitality from nutrient deficiencies. The fructose, that triglyceride, is what carries these toxic residues into cells of the body, primarily fat cells, and that's why it's so difficult to lose weight. Yeah. So I know I didn't explain it thoroughly.
Well,
but
no, that was awesome. That was awesome. So, Dr. Haskell, you recently met an 80-year-old man that is a marathon runner.
Yeah.
Tell us about that story.
Yeah, this was a story we had. I love purification, getting toxins out, so I do a lot of saunas. So we met in the sauna at the rec center. Told me his life story, and we tried to, I wanted to ask him, how is it that you've remained so fit at 81, so vital at 81? So he talked about his life a little bit.
Wow.
And part of it, what I felt was important to recognize, was that he was born in, I think it was 1934. His parents and ancestors were from Greece. They had their own, what he called a victory garden, which is all organic, no chemicals, no pesticides. Well, there were probably no pesticides in those days, in the 30s, until World War II came, and a lot of the sort of chemical warfare things that were developed became the foundation for the development of pesticides and herbicides. So that period of time from infancy to probably 12 to 14 years of age is such an important formatory period of our whole health. So he was eating whole foods, organic foods, which they probably didn't have the word, well, they had the word in those days, but in those days, just healthy vegetables and fruits from their garden. So he was not exposed to chemicals in those first 10, 15 years of his life. And now you look at children being raised in this world and how their chemical and environmental exposures
it's like they don't have a
in the
chance.
household, so they're really, their full blossoming is inhibited by these chemicals and residues in our environment.
Wow.
Yeah.
What do you do, Dr. Haskell, here at your clinic?
Yeah.